Okay. Good afternoon, everyone. Good afternoon, everyone. My name is Dr. Abhay Agarwal. I am a consultant orthopedic surgeon in Apollo Excelcare Hospital. I am a sports medicine specialist dealing with all kinds of injuries related to sports and non-sporting activities which lead to any kind of ligament injuries or joint injuries in general. So today's this live talk that I'm going to be giving about is in general about giving awareness on sports medicine and how it benefits patients. So in general, sports medicine is not something only that it deals with sports injuries or athletes. Sports injury is a branch of orthopedics which deals with injuries related to soft tissue around the joints and also the bones, but most commonly seen in sports athletes. Now, how are we different from orthopedic surgeons? There is no difference as such. We do the same training in medical school. We complete our orthopedic training like any other orthopedic surgeon. Just after completing our orthopedic surgery training, we then go into further fellowship trainings which deal with sports injuries in general. So it is both non-surgical training as well as surgical training when it comes to becoming a sports medicine specialist. Now, sports medicine is just not one man's job. It's a team effort. So it involves a sports physiotherapist, it involves a sports psychologist, and so on. So sports medicine is a very vast field in itself, and hence that's why it's become a separate branch in total. Now, who is a sports person? So it does not mean that it is only for athlete sportsmen who play professionally. Any person who has recreational activities to stay fit, who goes on weekends to play sports or does any kind of physical activity during the weekends or 3 days a week whenever he has time, who is not completely sedentary in lifestyle, is a sports person or an athlete in general. And if they sustain some kind of injury, then they should be referred to a sports medicine to have a look and see whether he has developed any kind of injury. Now, it need not be only that somebody who has pain or who has twisted his ankle or he's twisted his knee is the only person who should be going and getting looked at by a doctor of a sports medicine specialist. Somebody who is trying to work out and is not able to work, somebody who thinks that I was a fit person before and now I've took a long break and I've rejoined playing sports or any active physical activity and I'm not able to live up to the expectation that I was expecting to work. So there could be other things that can make you unfit, and for that you need to visit a sports medicine specialist. Coming to next part of it, now I'll give you a very simple example. Somebody who used to play cricket, suppose in his early days, childhood, even in his college days, and then somehow he did not get time to continue playing cricket, and 5 years, 10 years down the line, he thought that I should get back and start playing cricket again for a hobby or just to stay a little fit. And once they get back, they go play the first day and then they come back with a lot of pains in their body, lot of soreness. Sometimes they have back pain, sometimes they have knee pains, and they realize that I might have injured myself, and they go on bed rest, and eventually they stop playing again. They get demotivated. So it is not because that you have not played, because you have not played for so long, and you just go one fine day and play, give your best, your muscles are not acquainted and not endured enough to play at such a such a high intensity level, and hence you need to meet a sports physiotherapist and train yourself and understand, get educated that how you should get back to playing sports again. It is not that you will not be able to play again, but you need to take it a little slow and stepwise. According to few datas, recreational sports people like who play on weekends are the ones who injure the most, and it is not because that they don't know the sport, it is because they come back after a very long time to play and eventually land up pulling their muscle or having a twist injury around their joints. So coming to common injuries that we see in sports, so all sports have very specific injuries in common. And now coming to cricket, so most common would be shoulder injuries, knee injuries, ankle injuries. So a lot of movement is there in the body when it comes to cricket. All these tennis racket games that you play, so they are very prone to having elbow injuries and shoulder injuries. Especially people who go to gym, so they should be really take care of their body and be very well educated when they join a gym, that they should be very careful in lifting weights and proper warming up their body, cooling down their body, doing stretches, because gym is something which is being very trendy nowadays in the youngsters and even in the old people who don't have much time to go for outdoor sports. They do tend to go to gym and do some form of workout every day. But being said that, the injuries are also increasing because of it. So what I suggest is that you should really find yourself a good coach or a trainer and understand that you need to warm up properly before you hit the weights. You need to not lift too excessive weights and not straight away start lifting. It's not the right concept of thinking whether you'll be, the more heavy you lift, the more faster your body will be built. So you need to take it very slow. It's a slow process, and once you have done your workout, once you have played your sport, you definitely need to do stretching exercises so that post workout you don't feel muscle soreness and all those aches that you get in your back, in your biceps and in your legs. So a little technical thing, so something stretching, there's a very common thing that people ask, that whether stretching should be done during the warm up or post exercise. So there is something called dynamic stretching. So dynamic stretching is something that you do before your actual sport, and you pump up your muscles, you bring all the blood flow into your muscles so that you're all ready to give your best. So that is something called as dynamic stretching that you should do before the sport. And once you are done with your sport, you should be cooling down your body slowly, stretching all those muscles which you have used, because if you do not do that post workout, you will definitely have a lot of muscle pain, and it demotivates you to go to the next day to hit the workout, and it's very difficult for you to then get back to your sports. You take 3-4 days of rest and then eventually lose hope of playing again. So now something definitive that we are going to talk about is, most of you have heard in common that people do get ACL tears in their knee, and some people get scared of these injuries and they don't go to sports again. So it's a very wrong notion. There are very famous celebrities and sports people who very commonly have these injuries. They get operated for these injuries and they get back to their sports professionally again. So there is nothing like that if you get surgery done you are going to be handicapped or anything of that sort. So as I said, sports medicine is a teamwork. So when it comes to these ligament injuries, not all injuries require surgery. If you come in a proper time, in an early time, once you get injured, get evaluated properly by a specialist, you might not even require any surgery. And with a proper treatment plan, you can get back to your normal day-to-day activities in general. What happens is that people they play sports, they have some pain, they just take rest at their home, they don't get it looked at, and then once the pain is gone, they start doing their activities and then eventually again end up having an injury. So these repetitive injuries that keep happening are the reason why your pain doesn't go and you start having these chronic aches. You stop playing and then still the pain does not go, and then you'll end up showing the doctor when it is too late. So coming to professional athletes who require endurance training. So what happens is athletes have to worry professionally about only two things in general. One is burnout and one is overtraining. So a lot of athletes who are young, who are amateur, who are training professionally, they tend to their coaches, their physiotherapists, they tend to push them a little more every time to train harder, longer times. The intensity keeps increasing, which is required looking at the professional level. But then the biggest concern is that these athletes land up being completely burned out. They land up having overuse injuries and fatigue, and their performance decreases. So a constant education is required at every level and every step, with the team effort of a sports physiotherapist and a sports psychologist, with an integral part of sports medicine. They need to follow up with their athletes in different sports, and when they suffer some kind of injury, and that is where the last team player, that is a sports medicine specialist as a doctor, comes into play to help them out with these injuries. So the key behind good teamwork is that when you have any sort of injury on the field or off the field, or you feel that you have played but you did not injure yourself, but still you have some kind of pain and aches that is going on, you should definitely not take it lightly. You should definitely not self-treat yourself, and if you think that it is persisting, you should come and show to a specialist. Some basic preventive and primary treatment that you can take during the injury, if it has happened and you cannot reach the doctor on time. What you can do is something in a short form that we call is RICE, RICE. So the key is R is for rest, I is for icing the area that you feel pain, C is compression. So if you can catch hold of a crepe bandage or a cap that you can put it on, and so that is how you give a primary treatment before you reach the hospital or the doctor. So anything that further requires treatment can be evaluated in the center. A doctor would evaluate you clinically first, examine you, and once the examination is over, he might order you some test in the form of X-rays or MRI if required. And based on the evaluation, most of these acute injuries get treated by non-surgical way with some medicines and rest, and then eventually you need to get back on your feet with some rehabilitation exercises. A very common problem what we face as doctors is that patient's expectation is something that once the surgery is done, they expect that the patient is going to be completely all right by himself. So I would like to clear that now, that it's a very good platform for me to educate you guys that when it comes to any form of surgery, being orthopedic surgery or a sports medicine surgery, rehabilitation is a very, very important step. It is equally important like the surgery itself. The surgery is the crux of your problem, but then to getting back to your normal life, you need to go for physiotherapy and rehabilitation programs. You cannot take them lightly, and they are very, very important for you to be completely all right and getting back to your normal sporting. In fact, a lot of people who do not go back to their sports after such injuries is because of not getting proper rehabilitation done. Now, something I would like to talk about in general would be, a lot of people have this worry that once we do ligament surgeries, patients feel and they are very scared that it might re-injure themselves again. So they don't want to take that risk and chance. So definitely it's a concern for anybody who gets these injuries. But if you have gone to a specialist, got yourself treated properly, you have done your rehabilitation, you will be good as new. There are a lot of people who have had ACL injuries and they have done proper rehabilitation, and then they are right now lifting 100 kgs of deadlift, and there's absolutely no problem. So the key is that you need to understand is you should be able to take proper guidance from a specialist, and do not take your pains after doing gym or playing a sport, take it very lightly, because that can land up in some trouble. So just a second. Okay, so there are a few questions that we have come up with. How long does ligament injury take to heal? So depending on the ligament that is injured, ligaments usually are divided into three categories. Ligaments are something like a rubber band. So either they are stretched, that is grade 1, or they are partially torn, that is grade 2, or they are completely torn, that is grade 3. So the specialist would evaluate you and do further investigations, and based on your ligament status, grade 1 and grade 2, they usually heal in about 6 to 8 weeks with proper care and treatment taken early. And if they do not take treatment on the early stages, they can land up either converting these injuries into a complete tear, that is grade 3, or they can land up having a permanent pain problem which eventually would require surgery. So as I've been overemphasizing again and again, these injuries usually heal properly by themselves without surgery, but they need to be addressed at as early as possible, because improper treatment can land up into a complete tear. So we have another question. What do you do when you get a shin injury while playing football? So according to the professional guidelines that have been put up by FIFA and other sporting organizations, all these on the field injuries are evaluated by the on-field doctor. It can be a team physiotherapist as well. So depending on the grade of injury, a quick assessment is done. The athlete is brought out of the field, and then he is evaluated, and based on the findings, if the injury looks to be severe at that moment, the athlete is called off the field and taken to the medic bay, and whether there is, so depending on the intensity, in the severe cases we do get some kind of fractures as well. If they are very severe, there are sometimes sprains of the ligaments, and sometimes it is just a twisting injury. So what happens is evaluation on the field is very important and very crucial of these sports injuries. That is why you need to have a sports physiotherapist or a sports specialist around the event who can quickly evaluate and decide whether this injury has to be taken lightly or not. And once the evaluation is done and he cannot play, as I said, you should take up primary care treatment in the form of icing, compression bandage, immobilization of that part of the leg, and then sent to a proper hospital for further evaluation and treatment. So we have another question. How do you distinguish between different injuries, and how we know if it's ligament, tendon or muscle tear? So for anybody to understand between these injuries is that three common things that we see when coming to any kind of injury is the site of the pain, where you're having the pain. Second is how bad is the pain, whether it is too severe, whether it is mild pain, whether the pain only happens when you are doing some activity, or if the pain is continuously present which you are not able to tolerate. So how bad the pain is, how's the intensity of the pain, and whether that pain, where the site of the pain, is there any kind of any swelling or any redness, or do you feel it is warm. So these are few things that anybody who has this kind of injury can have a look by themselves and understand that there is something wrong, that the pain is too much on touching, there is big swelling which has occurred around it, and it's become warm and it is increasing in size, the pain is increasing, I'm not able to move the leg or the part of the injured place. I was able to do it 2 hours before, but now I'm not able to. So he should understand that the severity has increased, and he should immediately go and get himself checked. So how do we know if it's ligament, tendon or muscle tear? So based on as I said, based on the location. So similar to any fracture, so if the bone breaks, you feel that the exoskeletal, the bone structure is not in its place. Similarly, when you have any form of ligament injury, your body is not able to control that part of the body. So you will try to move, but you don't have control over it. So these kind of sensations. So when you're trying to move the particular limb, you will have a lot high intensity pain. You're not able to. You will be like completely frozen at that moment. So these kind of feelings that you get is something that you should get yourself checked at. I hope these questions have been answered and understood by the people who have asked. Anything else? So I would like to thank Apollo Excelcare Hospital for giving me this opportunity to give a talk and educate about sports medicine in general. And I hope if I've solved few queries and have cleared some doubts regarding this field, and hope to see you soon and give further talks. Thank you.